Hi, this is Terry Kuti, founder and director of Deep Sea Foundation, the educational YouTube channel where we talk about all topics related to breast reconstruction. I'm joined again today by one of my favorite guests, Dr. Minos Chrysopoulou, who is from PRMA in San Antonio, Texas. He is a board-certified reconstructive surgeon who works with an amazing group in San Antonio. But Dr. C is also a huge proponent of the shared decision-making model in breast reconstruction, and he is the founder and developer of the Breast Advocate app for all patients that have been affected by breast cancer. So I invite you to check that out at breastadvocateapp.com. Dr. C, welcome to the program.
Thanks for having me, as always. Did you say I'm one of your favorites? You said that. That's on tape.
I don't know, we might have
You
to...
said that, it's on tape. All right, moving on.
Well, I love having you surgeons on who are so focused on patient education.
Thanks. That's a big deal. I appreciate it. You got a bunch of great people involved. You got some great surgeons. That's awesome.
Well, it has developed over the years, and I just couldn't be happier about it. You know, being a former.
Yeah. Well, they wouldn't be getting involved if you weren't doing such a great job. So kudos to you.
Oh, thanks, Dr. C.
Yeah, you're welcome.
I got another topic that we've had some patients ask about. What is the benefit? Because not everyone has immediate reconstruction. So I'm talking now about autologous reconstruction, which is using your own tissue in the setting of a delayed reconstruction. Let's say a woman has a mastectomy and a few months down the road, for whatever reason, she has a delayed DIEP flap. Maybe it's a few years down the road. What are the benefits of DIEP flap after a woman has had radiation?
Great question. So radiation does create some usually or often significant changes. Radiation is recommended because it decreases the risk of the cancer coming back locally, so in the chest area. And there's also some data to suggest that in some people it improves survival. So it's a very important part of breast cancer treatment. And it's definitely come a long way as well. Techniques have really improved. But there are still some side effects, like everything, unfortunately. So yeah, you can have two patients, identical diagnosis, identical treatment plans. One ends up doing really, really well with minimal radiation changes, and the other patient really reacts more significantly in terms of the soft tissue changes that we see. So what are they? So it's fibrosis, in other words, scarring. The remaining tissues can get quite tight sometimes. All the tissues kind of thicken up and scar. So that includes the skin, the fat under the skin, the muscle of the chest wall. You can have some deeper side effects too, to the lungs and heart, depending on which side of the chest the radiation is on. But radiation and radiation techniques have come a long way, but despite that, we can't change the patient's biology, and that is really important in how radiation changes things. So reconstruction can still be performed at the same time as a mastectomy, so an immediate reconstruction can still be performed if radiation is planned after the mastectomy. But still, most plastic surgeons prefer to wait on the reconstruction until after the mastectomy and the radiation has been completed. And usually an additional 6 months, that's, I think, most commonly the timeline that plastic surgeons follow. There's data to support waiting 12 months after radiation. Most of us don't wait that long. At PRMA, we're actually open to doing it even sooner than 6 months, and we'll do it at 3 months or even less, depending on the patient's situation and tissues and their overall reaction to the radiation. The The main concern is that radiation will damage the reconstruction if you do it at the same time as the mastectomy. So there are obviously benefits to immediate reconstruction from a psychosocial standpoint. You know, some women really can't deal with the notion and possibility of living without a breast, and for them it's a very, very big deal. Other women, whether they're having radiation or not, you know, they've got a lot of stuff going on, a lot of decisions to make. They may think they want reconstruction, they may be considering going flat, or they may know for sure that they want to have reconstruction, but they're not quite ready to think about those options just yet. And they just feel that, you know what, for them, it's better to just get through all the breast cancer treatment and then deal with the reconstruction later. That's so big benefit there is the, you know, you've got to know yourself and what you need. So some people do better from an emotional standpoint if they wait, because they feel much better, much more comfortable making the decision, weighing up all the options. And delayed reconstruction can be done at any time. So there's no time limit here. It's whenever you're ready. The downsides to delayed reconstruction is that the results typically aren't as good from a cosmetic standpoint. The scarring isn't as limited. In most cases, women need a patch of skin showing on the breast to reconstruct the overall skin envelope to give the breast the desired shape. Whereas with an immediate reconstruction, it's often very possible to make the lady look like she's had a breast lift or breast reduction, or basically the scarring is a lot less with immediate reconstruction in most cases, especially with nipple sparing techniques. The biggest benefit of delayed reconstruction in the radiation setting is being able to replace the damaged soft tissue with healthy tissue from another part of the body. So take, for example, the lady where, you know, she didn't have a good biological response to radiation. She's got significant scarring, significant tethering of the tissues. She feels like her chest is really tight. There's something preventing her from really getting her full range of motion. The muscle is tight. She feels really restricted. The benefit of delayed reconstruction there, using tissue specifically, is that all that scar tissue can be released, much of it can be removed, and you're replacing that entire area with healthy, warm, soft tissue from another part of the body, virgin tissue with a great blood supply. And that not only restores the nice, warm, natural breast, but there's also evidence to show that bringing in healthy tissue like that can help actually regenerate the remaining tissue and improve some of the radiation damage if you've still got other tissues left behind that you can't remove. So there are pros and cons to everything, Terry, as you know, immediate, delayed, depends on your situation. There's no right or wrong for everyone. But I would say for me, particularly for the patient who's had radiation, delayed reconstruction using their own tissue really provides the benefit of replacing that damaged radiated tissue with very healthy, warm, soft tissue. And all the benefits of that, especially physical therapy, as you know, is something I'm very keen on. So replacing all that scar tissue, bringing in the healthy tissue, then allows the therapist to get to work and get some of that range of motion back. Does this resonate at all?
Well, I think we're going to wrap this session up. We will move on to another one soon here. We're going to wrap this up by saying, yes, it does. This is exactly what I had. I had a delayed DIEP flap. And the morning you walked into my surgery, because you did my reconstruction, you talked about this scarring. And women ask me about the benefits of having a DIEP. And I tell them, I never laid on my left side for 12 years because I had radiation in 2002, recurrence in 2014, left side sleeping all the time now. Might not be good for my wrinkles, but it's so wonderful, though, to be able to have my range of motion back and to have that new soft, warm tissue. So, Dr. C, great explanation today. Thank you very much. You did talk exactly about my experience, and it's of great benefit to have DIEP flap, even in the delayed setting after radiation. Thank you for joining us today. If you have any questions or comments about this video, please put them in the comment section, and we love it when you like our videos. Let us know if there are any other topics we can talk about. Dr. C, thanks for your time today.
Always. Thanks, Terry.